Welcome back to Western New York Living. If you suffer from varicose, spider, or other vein problems in your legs, you know it can be painful and cause problems with everyday activities. For over 20 years, the Cosmetic Vein and Laser Center has been treating these type of vein problems by utilizing the newest technology and non-invasive treatments. I recently stopped by their offices to see how they're helping people love their legs again. It's estimated that over 80 million Americans have some form of vein problems. Two of the most common are varicose and spider veins, which is not only aesthetically unpleasing, but can also cause pain, heaviness, fatigue, and lead to much larger medical issues. At the Cosmetic Vein and Laser Center in Williamsville, they take a holistic approach to identify and treat underlying venous flow problems.
We've been doing vein work for 20 years, and it's not just fix one vein. It's about improving the patient's blood flow, what they feel and what they see, down to the little detail. We start first with the functional veins so that they have less swelling in their legs feel better. And that will then allow us to take it to the next step to clean up the bulging veins and also improve the purpley spider veins.
Most people are very familiar with the look of varicose and spider veins, but many people may not realize they suffer from venous reflux, a main cause of varicose veins, before they actually see the veins appear on their legs. The symptoms are very recognizable.
The common symptoms are your legs are heavy, they're tired. At the end of a long day of shopping, you may have to go home and put your feet up, or maybe stop, in the middle of your day on a bench for 10 minutes because your legs are aching. So it's the type of pain that happens with standing for long periods of time. I have patients tell me about Thanksgiving dinner, their legs are killing them. Trip to Disney World, you walk more than you've ever walked and your legs are killing you. These are all signs that that flow may not be right in your legs, and a simple ultrasound, which is non-invasive, will tell us everything about the direction of the blood flow in your legs.
A lot of people think at the end of the day they take their socks off, they have a ring. This ring is normal and they're just getting old, but it's actually a sign of reduced blood flow out of the legs. And so when we do our ultrasound, we can look at the valve function and determine which veins have gone faulty and then treat them accordingly.
If you consider that the deep veins of our legs are really doing 90% of the work. So a lot of these veins that are coming off of that are just faulty veins aren't doing anything for you. If anything, they're causing problems and symptoms. So really that's what we're trying to determine, if they're problematic and how we can fix them.
All the vein treatment procedures at the Cosmetic Vein and Laser Center are minimally to non-invasive. They are done in an outpatient setting at their offices, and all the doctors are board certified. They are also now happy to be performing the VenaSeal vein treatment to alleviate vein reflux.
The VenaSeal closure system is really a very high quality medical grade polymer or superglue, and it's administered through a very tiny catheter into the vein. What does this do for the patient is it permanently shuts that abnormal vein so the blood flow improves and the patient's swelling improves, their symptoms improve. 20 years ago, patients would have, it wasn't a death sentence to have a vein problem, but the surgery was almost worse than the problem itself, and so most patients would just live with it. Now, everything's done in the office under local anesthetics, minimally to non-invasive, and patients go back to normal life right away, feeling better. Even within a 2-week period, they feel better than they did before they came here.
One of the reasons I love to talk about veins in the fall and the winter is that this is the time to treat. It usually takes 2 to 3 treatments, even if you come to us with spider veins. And if I could capture my patients' enthusiasm when, after they're done with their spider veins, they look down and say, why did it take me so long to do this? Why did I spend 12 years in capris when I could have just done these 3 treatments? So give us the time to do it and you'll be so happy in those summer months.